Um, Good morning. I will talk about gastrostomy tube today. I am Akram Jahdari, consultant pediatric surgeon at Johns Hopkins Aramco Healthcare. What's gastrostomy tube? It's a tube that provides direct access to the stomach through the abdominal wall. As you can see in this picture, this is the alimentary tract, this is the esophagus, and this is the stomach that resides in the upper abdomen. The tube will provide direct access through the skin, abdominal wall into the gastric cavity. The skin, subcutaneous tissue, muscle into the gastric cavity uh, to help giving feeds, fluids, and medication. Which patient require the gastrostomy tube? It's usually the patient who are unable to eat normally due to neurological or muscular disease, or patient who are unconscious or sedated for a prolonged period of time. The second category of patient is patient with hypermetabolic status or metabolic disease. Those patients may require special formulas or extra amount of calories and fluids that they cannot keep up with normal oral intake. The third category is disorder of intestinal absorption, such as intestinal failure or short bowel syndrome, who again require special formulas and special technique of feeding that we cannot do and monitor by oral intake. How we can insert it? There is 3 common ways of inserting gastrostomy tube. The first and the most common way is laparoscopic insertion by keyhole surgery. The second way is an open incision, about 4 to 5 centimeters incision in the abdominal wall, and inserting the gastrostomy tube into the stomach. The third way is percutaneous insertion by blindly going with the needle into the stomach through the abdominal wall. We use gastroscope as a guidance, which is a tube that goes through the mouth into the stomach, or use ultrasound guidance. Here at Johns Hopkins Aramco Healthcare, we recommend the one with the most successful rate and the least complication rate, which is the laparoscopic gastrostomy tube insertion. It takes about 30 to 40 minutes to insert. How we insert it? Under general anesthesia, small incision below the umbilicus here, about 5 millimeter. We insert the camera, visualize the stomach, bring the stomach and tuck it to the abdominal wall and insert the tube about 3 to 4 centimeters below the costal margin on the left side. Sometimes we need a third port that can again 5 millimeter in the right upper quadrant. The tube will look like this at the end. This is the external component of the tube, which is the button, and the internal component has a balloon that helps holding the tube in place inside the stomach. Complications. The most common complication is leak around the gastrostomy tube. Usually improves with time, especially with improvement in the patient nutritional status. More fat will develop and help sealing the tube around the skin. We have to make sure the tube is inflated with 4 to 5 millimeter of water to help the seal. Applying cotton pads underneath the tube help again the seal, and at the same time absorb any minor leak around the gastrostomy tube and keep the area dry. The second complication is development of granulation tissue. Granulation tissue is an inflammatory tissue that grows around the gastrostomy tube as a reaction to the foreign body, which is the tube itself. Usually it's mild to moderate and requires no treatment, but sometimes it can be extensive, like this patient, and needs treatment. The treatment is painless procedure we do at the office by applying silver nitrate tips into the granulation tissue that helps cauterizing it. Sometimes we need more than one session to make sure it's completely eliminated. Again, it's painless and usually quite successful. The third most common complication is accidental dislodgement. What we mean by dislodgement is that the tube comes out from its place. Usually the surgeon and the gastrostomy tube nurse will educate the family how to handle the situation before going home. Um, if it happens, then the family will try to reinsert it in its place, tape it, and go to the nearest emergency department. If they cannot reinsert it, just go to the nearest emergency department and bring the tube with you so they know what size and what type of tube to reinsert it. The doctor will confirm the position of the tube after reinserting it, and sometimes use contrast to double check before giving medication or feed through the gastrostomy tube. It's usually advisable to have a spare tube at home, especially during traveling. So if they require to put a new tube or the tube comes out, then they have replacement of that tube. Thank you.